Good day, I'm Dr. Allan, Medical Director of Regency Regenerative Medical and Aesthetic Clinic. At Regency, my role is to evaluate our patients, oversee our regenerative medicine program, and help ensure that every treatment decision is guided by proper medical evaluation, patient safety, and realistic expectations. Regenerative medicine is an evolving field of medicine focused on supporting the body's natural processes of repair, recovery, and tissue function. It includes approaches being studied or used in different settings, such as cellular therapies, platelet-rich plasma, and other biologic treatments. At Regency, we believe regenerative medicine begins with a careful medical evaluation. We consider the patient's condition, medical history, available scientific evidence, potential benefits and risks, and appropriate treatment alternatives before recommending a personalized plan. Mesenchymal stromal cells, commonly referred to as MSCs, are cells that have been extensively studied in regenerative medicine. They can be obtained from several sources, including bone marrow, adipose tissue, and birth-associated tissues, such as the umbilical cord. Researchers are particularly interested in their ability to interact with the body's immune and inflammatory responses and to release biological signals that may influence tissue repair. However, it is important to understand that many applications of MSC-based therapy remain investigational, and results can vary depending on the condition, the cell product, and the individual patient. At Regensy, we believe patients should understand both the potential and the limitations of these therapies before making a treatment decision. One area of particular interest in regenerative medicine is the use of mesenchymal stromal cells derived from birth-associated tissues, including the umbilical cord. The umbilical cord contains several tissue compartments, including Wharton's jelly, which has been widely studied as a source of mesenchymal stromal cells. These cells are being investigated for their biological signaling, immunomodulatory, and tissue-supporting properties. The quality of any cellular product is extremely important. Source screening, processing conditions, sterility, cell identity, viability, and appropriate quality controls all contribute to the safety and consistency of a cell-based product. At Regency, regenerative medicine is not approached as a one-size-fits-all treatment. Every patient begins with a comprehensive medical evaluation. We review the patient's diagnosis, symptoms, medical history, current medications, previous treatments, laboratory findings, and other relevant diagnostic studies. We then determine whether a regenerative approach may be appropriate and discuss reasonable expectations, potential risks, available alternatives, and the limitations of treatment. Patient selection and safety remain central to every recommendation we make. Mesenchymal stromal cells are being studied not simply for their ability to become different cell types, but especially for the biological signals they release. These signals may influence inflammation, immune responses, blood vessel formation, and the activity of surrounding cells involved in tissue repair. This is sometimes described as a paracrine effect. Rather than thinking of MSCs simply as replacement cells, researchers increasingly study how they may communicate with the body's own cells and influence the local environment. These mechanisms remain an active area of scientific investigation because regenerative medicine involves several different biological approaches. Research is taking place across many areas of medicine. These include musculoskeletal and orthopedic conditions, inflammatory disorders, cardiovascular and neurologic diseases, and other conditions involving tissue injury or degeneration. However, the level of scientific evidence differs substantially from one condition to another. Some applications have more clinical research behind them, while others remain experimental. At Regency, we do not assume that a regenerative treatment is appropriate simply because a patient has a particular diagnosis. We evaluate each case individually and discuss what is known, what remains uncertain, and what treatment options may reasonably be considered. One of the most actively studied areas of regenerative medicine is musculoskeletal and orthopedic care. Research has examined biologic approaches for conditions involving joints, cartilage, tendons, ligaments, and other musculoskeletal tissues. For patients with joint pain or osteoarthritis, the goal of treatment may include improving function and reducing symptoms, but outcomes vary from patient to patient. Regenerative treatment should not be presented as a guaranteed way to regrow cartilage or reverse advanced arthritis. At Regensy, we consider the severity of the condition, previous treatments, imaging findings, overall health, and the patient's individual goals before discussing whether a regenerative approach may be appropriate. Another approach used in regenerative medicine is intravenous administration. With intravenous delivery, biologic products enter the circulation rather than being placed directly into a specific joint or tissue. This route is being investigated in a variety of clinical and research settings, but the distribution, biological effects, and potential benefits depend on the type of product being administered and the patient's condition. Intravenous regenerative therapy should never be considered a universal treatment for disease. At Regensy, the decision to consider an intravenous approach begins with medical evaluation, review of laboratory findings, medications, underlying conditions, and potential risks. When appropriate, treatment is performed under clinical supervision with careful patient monitoring. Platelet-rich plasma, commonly called PRP, is another regenerative approach used in musculoskeletal and aesthetic medicine. PRP is prepared from a patient's own blood. After collection, the blood is processed to concentrate platelets and their associated growth factors. These biological signals are being studied for their potential role in supporting tissue repair and healing responses. PRP may be considered for selected joint, tendon, ligament, and soft tissue conditions, as well as certain aesthetic applications. Because PRP is derived from the patient's own blood, it is different from stem cell-based products. At Regensy, we determine whether PRP is appropriate only after evaluating the patient's condition, treatment history, and individual goals. Exosomes are another area of growing interest in regenerative medicine. They are extremely small extracellular vesicles released by cells and can carry proteins, lipids, and genetic material that participate in communication between cells. Researchers are studying how these biological messages may influence inflammation, immune responses, and tissue repair. Unlike mesenchymal stromal cells, exosomes are not living cells and cannot reproduce or become other cell types. Their composition and biological activity can also vary considerably depending on their source and how they are produced and processed. For this reason, quality, characterization, sterility, and appropriate clinical oversight are particularly important. At Regency, we believe patients should clearly understand the investigational nature, potential benefits, limitations, and uncertainties surrounding exosome-based therapies before considering treatment. Regenerative and wellness medicine may also include supportive approaches such as NAD+ therapy and selected peptide-based treatments. NAD+ is a naturally occurring coenzyme involved in cellular energy metabolism and many essential biological processes. Peptides are short chains of amino acids that can function as signaling molecules within the body. Different peptides have very different biological actions, and their evidence, regulatory status, potential benefits, and risks must be considered individually. These therapies should not be presented as cures or substitutes for established medical treatment. At Regency, Supportive therapies are considered within the broader context of the patient's health, medical history, medications, laboratory findings, and treatment goals. Our objective is not simply to offer a product, but to determine whether a particular approach is medically reasonable for the individual patient. Patient safety begins long before any regenerative procedure is performed. At Regency, every patient undergoes an individualized medical evaluation. We review the diagnosis, current symptoms, medical history, medications and supplements, previous treatments, allergies, laboratory findings, and relevant diagnostic studies. We also consider conditions that may increase treatment risk or make a particular therapy inappropriate. When necessary, additional laboratory testing, imaging, or consultation with the patient's other physicians may be recommended. We then discuss the proposed treatment, reasonable alternatives, potential benefits, possible risks, limitations, and the uncertainties that may exist in the scientific evidence. Informed consent is an essential part of this process. Our goal is not simply to determine what treatment we can provide, but whether a treatment is appropriate for that particular patient. An important part of regenerative medicine is having realistic expectations. No regenerative treatment can guarantee a cure, complete recovery, or reversal of disease. Outcomes can vary considerably from one patient to another because every person's diagnosis, age, overall health, severity of disease, and biological response are different. Some patients may experience meaningful improvement, while others may experience limited improvement or no significant benefit. When improvement occurs, the timing and duration of that response can also vary. At Regency, we believe patients deserve a balanced discussion of both the possibilities and the limitations of treatment. Our responsibility is to provide the best medical guidance we can based on the available evidence, the patient's individual circumstances, and careful clinical judgment, not to make promises that medicine cannot guarantee. At Regency, Regenerative Medical and Aesthetic Clinic, our philosophy is simple. Medicine should remain centered on the individual patient. We combine careful medical evaluation, available scientific evidence, responsible use of regenerative and supportive therapies, and appropriate clinical monitoring. We recognize both the promise and the limitations of this rapidly evolving field. We do not believe that every patient needs regenerative treatment, nor that one treatment is appropriate for everyone. Sometimes the best recommendation may be a regenerative approach. At other times, it may be conventional treatment, further evaluation, or consultation with another specialist. As a physician-led clinic, our commitment is to help each patient make an informed decision based on safety, medical appropriateness, realistic expectations, and respect for the patient's individual goals. As Medical Director of Regency Regenerative Medical and Aesthetic Clinic, my commitment is to practice regenerative medicine responsibly, ethically, and always with the patient's welfare at the center of every decision. This field continues to evolve, and I believe our responsibility as physicians is not only to explore its possibilities, but also to understand its limitations. We will continue to follow the science, evaluate every patient individually, and never promise what medicine cannot guarantee. Our goal is to provide hope grounded in evidence, treatment guided by careful medical judgment, and care delivered with compassion. Thank you for joining me. I am Dr. Allan, and I welcome you to Regency Regenerative Medical and Aesthetic Clinic. Thank you for watching.